Hey guys, okay. My rare disease is going to be on Rapunzel syndrome, or it is also known as trichophagia. Trichophagia is the compulsive eating of hair associated with trichotillomania, which is just hair pulling. In trichophagia, people with trichotillomania also ingest the hair that they pull, and in extreme and rare cases, this can lead to a hairball. So literally, it's like a cat. Trichophagia comes from the Greek words tricho, which means hair, and phagian, which means to eat. Trichophagia is known as compulsive eating of one's hair. Trichophagia is not when an individual is mindlessly chewing on the ends of their hair, as many young children do when they are bored. Trichophagia occurs when hair is chewed and then swallowed. Trichophagia is mostly known as a gastrointestinal disorder of trichotillomania. Trichotillomania sufferers will only pull out their hair, they will not eat it. Therefore, trichophagia tends to start out as trichotillomania before the hair eating begins. This disorder is believed to be associated with impulsive disorders or anxiety. A lot of anxiety patients will be seen taking their hair and rubbing it against their cheeks or mouth as a source of comfort, is what I would say it is, because kind of like whenever you're like going through a stressful event, or just stressed out in general, you kind of like either like play with your hair like this, or some people like make a mustache out of their hair just to kind of feel it right there, or even like scraping it across their face. The etiology of trichotillomania is largely unknown, though both environmental and genetic causes have been suspected. Explanations that have been proposed for the onset and maintenance of the hair pulling behavior include the following, which is coping mechanism for anxiety or stressful events, a benign habit that developed from a sensory event, co-occurring with another habitual behavior, kind of like thumb sucking in young children, because like I think of it as like ADHD, always having to do something with your hands. A serotonin deficiency, structural brain abnormalities, and abnormal brain metabolism. So, signs and symptoms are kind of vary in this, because usually they're not detectable. They don't do anything about it until they're having that severe abdominal pain, and then they kind of notice the hair playing, and then it goes from there. Trichophagia is typically easily diagnosed preoperatively. Initially, hair playing as a child is a big one, as well as touching the hair on your face. Trichophagia is typically not detected until years after the patient begins this disorder. It starts with severe abdominal pain, nausea, intermittent vomiting, anorexia, weight loss, alopecia, and noticeable hair playing. Trichophagia is related to anxiety behavior, therefore signs may not be detected by others because it is done in private as a source of comfort for the patient. The patient, just like many anxiety patients, are typically embarrassed, and they usually don't want to talk about it, because you don't want to just talk about, hey, I ate my hair. No. Patients with the disease should be aware of the symptoms and complications that could come with the habit of eating hair. To me, this is, I wouldn't say a normal behavior, but a normal coping mechanism, I guess, because if you kind of just, a lot of people also kind of like pica. A lot of pica patients eat cornstarch. Complications with this, there are many complications associated with trichophagia, include like obstruction in the intestines, weight loss, need for surgery, depression, peritonitis, and the list goes on and on. Treatments, there are some treatments for this. There is no cure for trichophagia. However, there are helpful ways to overcome the disease, such as anti-anxiety medications and psychotherapy tend to help those at the beginning of the disease and also after surgery, because even though they take going through the intestines and remove the hairball, you still have that urgency to play with your hair and eat it. So you, after surgery, they want you to continue the psychotherapy and the medications to kind of slow down that urgency to want to do that. An endoscopy and CT scans provide ways to diagnose patients accurately in order to begin treatment, because usually, like I said, it starts off with severe abdominal pain, and then also, I'm going to show you later, it'll kind of like be like a protruding, because it's like a hairball in your intestines, and it will kind of like protrude. If the disease becomes severe, the patient develops a hairball and that blocks the intestine, surgery is needed. The most proved method for removing the obstruction is a regional laparotomy. It is where the hairball is removed in small pieces at a time to ensure that all is gotten out, and it prevents spillage of the hairball back into the intestines. So here is an example of an occurrence of trichophagia. It was a 13-year-old girl. She was normal intelligence, no known chemical imbalance in her brain. She presented with a 7-year history with hair in the feces and 3 months of upper abdominal pain with intermittent vomiting that worsened after meals. This girl was 5'4" and she only weighed 74 pounds. She looked pale and a little depressed. She had no patchy alopecia or halitosis. Physical examination revealed a flat abdominal wall, normal bowel sounds, and a large, solid, palpable mass from the epigastrium to the periumbilical region. However, there were no signs of peritonitis. The white blood cell was 4.4, but a complete blood workup revealed slight hypochromatic microcytic anemia with a hemoglobin content of 138 and a mean corpuscular volume of 82.3. The rest of the routine blood examination and blood biochemistry examination results were within normal limits. A CT scan demonstrated a markedly expanded gastric cavity. Within the cavity was a heterogeneous, hypodense, cast-like mass with scattered air bubbles that clearly oppressed the surrounding intestines. A similar agglomerate of mixed density was observed in the duodenum, while the colon was distended with gas. No significant thickening of the gastrointestinal wall or any other signs of necrosis were observed. So she didn't have any dying tissue. There was no infection noticed in there. This is the CT of the abdominal region. Right here, you can see like the huge mass that she has, and it's like it's making her kind of protrude. And they also said that it was palpable, so you could literally feel it. An upper gastrointestinal endoscopy revealed a giant hairball. I know it's gross. An attempt was made to remove the bizarre, which is just hairball, by endoscopy using detritus pockets and grasping forceps, but it was unsuccessful because, you'll see. Due to how big the hairball was, the patient underwent exploratory laparotomy. During the procedure, they revealed the huge hairball, and there was no incidence of necrosis or infection. The hairball was removed little by little until all was gone, and that's it. You can see all of like the food trapped up in there. That was kind of like stopping it. I don't understand how she went that long with that. And the extracted hairball, the outcome, if you can see how long that was, it starts here and goes all the way over there, and that was in her intestines. And that's it again right here. Crazy. Okay, in conclusion, treating the disorder of trichophagia is similar to treatment of other impulse control disorders. The disorder is believed to be caused by a chemical imbalance in the brain and can be treated with a combination of antidepressant drugs and psychotherapy. Trichophagia must also be treated medically if excess hair is within the digestive tract. Occasionally, the accumulation of hair in the digestive tract can cause a huge hairball, just like we've seen. This can cause many medical problems, and it has even caused a few deaths. A 13-year-old girl died from this. There has been research showing that long-term follow-up and professional psychotherapy are critical after the surgical removal of hairballs because, like recently stated, this disorder is attached to anxiety-like symptoms and is a lifelong fight to overcome. Okay.